toxoplasmosis depend mainly on the laboratory diagnosis. The medical diagnosis less important or less effective in case of toxoplasma. We depend mainly on the laboratory diagnosis. As we said before, toxoplasma gondii is present inside the man. It is man act as a blind host. There is no portal of exit. So we depend mainly in the laboratory diagnosis on the indirect method for diagnosis. Whether an indirect method, immunological method or molecular biological method. In the immunological method, we either detect antibodies against toxoplasma or detect the antigen of toxoplasma. The antibody of toxoplasma can be detected by different technique. Most common one, ELISA, immunofluorescence. Other like indirect agglutination, indirect agglutination, and immunosorbent agglutination assay. Antigen detection can also done by different technique. It is very important in case of immunocompromised patient because the antibody titer here are low or absent. So we can't depend on the antibody in case of immunocompromised patient. No antibody here. So we depend on the detection of antigen of toxoplasma. Another indirect method or molecular biological method, which is by this method we detect toxoplasma DNA by PCR technique, whether in the blood or in the tissue of the host. The antibodies against Toxoplasma gondii is very important. We have two types of antibody, IgG and IgM antibody. IgG antibody usually develop later or take time to develop. We take within about 4 weeks after a primary infection, while IgM appear early. It is taken about 1 to 2 weeks after infection, usually 1 week to start to appear in the serum of the patient or in the blood of the patient. Both of them usually peak within 4 to 8 weeks, but usually a specific IgG can be continue in the peak for another week or 2 weeks. Then start the IgG to decrease. It passes through the plateau curve for months and then started to decline. But usually the IgM persists for months, year, or for whole life of the patient, which is usually okay. It persists inside the host or in the patient for whole its life. So it can't indicate in this case is a primary infection or can't differentiate between a primary infection or a chronic infection. But IgM, after the peak of IgM, it started to decline 4 weeks and months, then become negative completely, maximum for within 1 year. So it is very important in diagnosis of toxoplasmosis acute infection. Both of them is important, IgG and IgM, and most important is the IgM because it indicates acute infection. So we have a very important thing, how to diagnose patient with acute acquired toxoplasmosis. By depending on seroconversion of negative IgG to positive, IgG negative, then it changes to positive, or IgG titer, rising titer of the IgG, have low titer, then it is rise, or presence of positive IgM. This is the three important criteria for diagnosis of acute acquired toxoplasmosis. Another one is the antigen, detection of antigen. Antigen is present only in the acute infection, is also helpful, very helpful in diagnosis of acute infection. Our DNA of the parasite also by PCR. If it's positive, it indicates a positive or acute infection. So in toxoplasma, we can't depend on single serum sample. Single serum sample give no clear indication because if it's negative, if it's positive IgG, it may be chronic infection and it is not helpful for the diagnosis. So we must do different or many sample, take many sample from the patient, and it changes from negative to positive. Our rising titer indicate the acute infection. There is another type of antibody, which is the IgA. IgA more or less similar to IgM. It appears usually for acute infection, but it's prolonged for longer time. So it was the result by the IgA can't confirm or doesn't confirm the diagnosis. But how can you diagnose the toxoplasmosis in congenital toxoplasmosis in the newborn? In this case, can't depend on the IgG. Why? Because the IgG is passively transferred from the mother to fetus. It can cross the placental barrier. So in this case, the IgG, if it's present in the blood of the newborn, it have no significance because it may come from the mother. But the positive IgM is very important. It is more significant because the IgM have high molecular weight. This prevents them from pass through the placental barrier. So if it's present in the newborn or in the fetus, it indicates acute active infection. يبقى we depend in diagnosis of a congenital toxoplasmosis on the presence of IgM, not IgG, because IgM have high molecular weight, can't cross the placenta, so if it present, it indicate it's manufactured by the baby and indicate active acute infection of the newborn. A direct method, if can we do direct method, but it is less commonly done for toxoplasmosis like an indirect method. It is an invasive technique, and it is usually depend mainly on the texture of tachyzoid, which is usually or rarely detected either by smear of lymph node, a bone marrow, spleen, other material. We can find the tachyzoid of Toxoplasma gondii, or if this lymph node is enlarged and excised, ممكن do histopathological examination of this lymph node. We can find also التاكيزويد of Toxoplasma, but is rarely detected, and also it needs experience for detection. So the indirect method is most important than the direct method. It's more important than the direct method. إذن laboratory diagnosis for toxoplasmosis either by indirect method, which is very important, and also by direct method, it is less important than the indirect method. An indirect method either immunological method or molecular biological method. A direct method by smear, lymph node, bone marrow, spleen, and so on, or by biopsy. An immunological method either by detected antibody or detected antigen. A molecular biological method by detected DNA of the parasite. A smear and biopsy, in whether of them we can find the tachyzoid of Toxoplasma gondii. This is the laboratory diagnosis for Toxoplasma gondii, which is very important, depending mainly on the indirect method for diagnosis. The remaining part of the lecture, which is a clinical manifestation, a medical diagnosis, and the treatment of Toxoplasma gondii or management, will be discussed to you by Dr. Khalid Mohi. Thank you.